This is Dr. Tariq Hakky. I'm here with Atlanta Cosmetic Urology. We're going to do a video on cylinders. We're going to do a video on cylinders available currently in the United States. So we're going to talk about the AMS cylinders, and we're going to talk about the Coloplast cylinders. We're going to do another video hopefully on rear tips, and we won't be including Rigicon as it's not technically available inside the United States yet. So we're going to start with the American Medical Systems product. They've got two different cylinders available. You've got the LGX and the CX, and here I've got a connection where I've got CX and LGX side by side, and I'm deflating them just so you can see the LGX with its length that it's losing at the same time. So the LGX is length girth expansion, and the CX is just controlled expansion in the girth direction, right? And these are both the same size cylinders. And you can see that now that the LGX has been deflated, you can appreciate the length that it gains, which is nice. So the AMS cylinders have nice tips. If you look at these tips, they're rounded, they're capped off. There's little holes in these for the strings for us to slide the implants down. The arc radius of this is slightly less than human arc radius. And I did a clinical trial in 2016 where I looked at the arc radius of the human penis. Now, what the hell does that mean in English? It means the curvature or the curvilinearness of your dick, or the end of the erectile body versus the curvature of this. Like, which one's more curvy? And what we found in that trial was this tip and the Coloplast tip were not as curvy as the human penis. They were more pointy, where this one was not statistically significant, but more pointy. Now, both of them have these rocket shoulders, right? Those were areas that did not conform to the corpora. The corpora does not have rocket shoulders like this. And this has got a Dacron sheath and a silicone layer on top of it. And we're gonna take a look at the inside of these two devices right now. So just taking a look at these two devices on the inside, they're both made, you know, they have this silicone inner tubing, and it's about 0.5 millimeter. And you can see there's a Dacron sheath there on top of the silicone layer. You see that right there? You know, and we learned a long time ago that Dacron, it likes to get incorporated inside the body, right? So the Dacron sheath was covered by this layer of silicone. We had to do that because we started getting cylinder rupture. American Medical Systems and Boston Scientific were noticing that this tubing to the cylinders was rubbing on the Dacron. It was causing it to rupture, and the body was growing into this. So when you're inserting these devices, you have to make sure you don't put a tear inside the silicone layer, otherwise the body will grow into the implant. Now, if you need an abdominal aortic aneurysm repair, hey, great, you want that for the rest of your life. But if you grow into this silicone and the Dacron and you have a leaky implant, you don't want that broken implant with you anymore. You want to exchange it. So that can make revisions and exchanges quite difficult. The back of the implant on this is not pointy. I like that. It's good design. The rear tips will easily cap on here. We'll do a rear tip video, more on the rear tip video. Okay, so you can see there's a 3-layered inner in here inside the AMS products, right? The shoulder, right? There's this shoulder. American Medical Systems has a 33.3 degree angle shoulder that they have coming off. So when you're inserting this in the erectile bodies, you get this, you can see my fingers hitting this. As you're pushing it down, you have to push it down with this shoulder. Now, there's something that's normally on here called the booties, or these little protectors. They're little sheaths that go around this, and usually we tear them off and we approximate them to the corpora so this doesn't rub as much. Okay, so I'm going to inflate these implants. I'm going to get the girth of them, and they'll switch onto the Coloplast one. So you're going to see, right now, we're going to see an increase, and we'll measure the increase that the LGX gets in length. And usually it's about 2 centimeters, but we're going to hold these people to, you know, their word independently because, you know, we don't believe, we test but verify. And you can see as I'm inflating this implant that the LGX is advancing in the length girth direction. So if you're like concerned with length, this might be an option. However, I want you to throw caution to something. Where's the thinnest portion of the erectile body? Is one of the weakest portions. It's actually the urethra. So this is more likely to poke through the urethra and to become an eroded implant distally, right around the head of the penis. So if you're pushing this much, right, you can risk rupturing through the urethra, right? So that's a true downside. Now, max inflated. My hand inflated this with all 100 cc's into the system from the full concealed reservoir. We're going to give you a distance length between the two cylinders, right, of the LGX expansion difference of, I'm actually getting 3.03 centimeters, right? So it's not 2.5, I'm getting 3 full-on centimeters. Girth for the device is coming in at 17.6. So that's actually less than the Boston Scientific folks will tell you at 18, right? The CX is coming in at 18.6. So you got 18.6 and the LGX is coming in at 17.6. So slightly less in the LGX. Now, on turgidity, I don't have a cantilever test, but I can push down on the implant, and you can see that one bends rather easy. And I can push down this implant. It does not bend almost all. The CX, very rigid. That implant is very hard. Now watch, I'm gonna bend them together, and you can already see which one already wants the curve more, right? The LGX really wants the curve more. The CX is really not buckling, right? And you can see that this is a much easier to do that than to do this. Look, the implant actually kinks. A kink would show you that I need to actually torque it high degree. That means there's a lot of pressure. This doesn't kink, it bends. So this is actually a softer implant. I just showed you right there. If I wiggle them around, which one is getting more laxity? This one. The LGX is in the front, right? That tells me it's a weaker device because it's got more wiggle room, right? So this implant's good for a shorter penis. It comes in 15, 18, and 21. Right, and I think the 21 is just overkill, not going to work, probably not going to help you out. I wouldn't put it in personally. The CX, that's a pretty good implant, right? That's pretty rigid, right? It's not floppy like this, right? And this comes in the same sizes, right? So it goes up to 24 actually. So it's actually a little bit bigger, right? And you look at the back end of the implant, and they've got that fuselage look as you can see it's hand glued into the back of the implant, and then the caps are stamped on there, kind of like Coloplast implant. You can see the Dacron sheath. So overall, it's a nice implant. Now, deflated, right? This implant's got Dacron. Dacron's like a cloth-like material. So in the deflated state, you really don't have any corners. It's kind of more of a natural fit and feel, right? And I think that's a great thing that the Boston Scientific guys have going for them. And you can see there's no real corners in a deflated penis, right? And that's point, penises don't have corners, right? And I think that this is a very, very nice, fair interpretation of this implant. I think it's a good device. I'm not a big fan of the LGX. I would steer you clear of it. If you had Peyronie's disease, it would just accentuate your curvature. So people that cannot and should not have an LGX is anybody with Peyronie's disease and anybody with a large phallus. Why? It won't have turgidity, right? It's too floppy, right? So anybody with fibrosis needs a CX, right, or a Titan. Those are going to be controlled expansion in the girth direction. Anybody concerned about length, I think this is a greater implant for shorter penises. Anybody concerned with their flaccid look, good job. Downsides, really, if you go back into revisions, you're really kind of relying on the prior surgeon not nicking that other outer sheath layer, and you can kind of see me separating it here, you know, because if you lose that layer, that Dacron body will grow right into it. Okay, on to the Coloplast Titan. So the Coloplast Titan has got cylinder tip changes. I think 2013, they went from the fusiform to these caps that they just put on top. They're made of silicone. Again, they've got the holes, right? The arc radius or the curvature or the curviness of this is more curvy than the AMS or the Boston Scientific device. However, it's still too pointy when compared to human corpora. These designs are wrong, right? If you look, there is the shoulder again. You can see that human penises don't have this shoulder that the American Medical Systems and the Coloplast implants design have. There is no sidedness to either of these. And you can see the back end of the implant extremely pointy. And I think that this is a problem because this can really cause some pain. It may be designed this way for easy insertion, but I was never, and I'm not a fan of this. The back end of the erectile bodies are fusiform, but they're not this pointy. I think this is very, very pointy. I mean, that's sharp. If I put your hand and I just do this, it leaves marks on my palm, right? I mean, that's kind of pointy, right? So it can perforate through the corpora and can injure, it could injure it, all right? You're increasing the risk. Now, let's take a look here at the exit tubing. Look at that tubing. It's actually a 6-degree angle opposed to 33 degrees. So if you're inserting this, you don't have much, you have an easy slide in. See how my finger slides down that easy? You know, that's a nice easy slide in for the surgeon, right? So I'm looking at this point of view of the surgeon and the patient, right? And then you've got, you know, this fusiform fuselage look, and it's wider, of course, coming in at 20.1 millimeters in diameter. So we're getting right around what Coloplast was telling us for the cylinders themselves. This device is more plasticky. I mean, listen to it, right? So it has a more plasticky, rubbery type feel. The depth of the thickness of this implant is about 7 millimeters. So you can see American Medical Systems product was 2 millimeters on the inner, and the total thickness of the device was actually 1 centimeter, or 1 millimeter, where this is 0.7. So it's actually skinnier overall thickness, right? So I got 0.6, 0.7 millimeters as the thickness of this. So this is actually a little thinner, but more rigid based on the material. Now, in the deflated state, this implant has got the dreaded dog ears. And these corners, right, can bother patients. They can cause inflammatory reactions in the skin and the corpora because it's poking the guy. And so you kind of got this for 2 reasons. One, the material, the Bioflex is kind of a rubberier type of material, right? And, you know, you got this thinner material that's thicker, right? So it's less likely to get these corners. It's got the Dacron, right, which is a pro and a con, right? So it makes it so this is actually easier for the surgeon to do a revision. So if you're a surgeon and you're looking at a patient, you're like, man, I'm gonna have to go in a bunch of times on this guy's body because he's younger. I usually steer guys towards Coloplast because I know I'm going back in every 15 years or so, right? So if it's an older guy and he cares about the look and the fit and the feel and the form, I'm gonna go with a Boston Scientific product. So you can kind of see, and you can see how the little design tweaks make it easier for different parts of the surgery. Like this is pointy, probably easier to insert, probably less ergonomic as far as the design of the penis is. This is more round on this side than the AMS one, right? But still not round enough. And then, you know, this is nice fusiform fuselage design. Again, you can see they stamped on the top here and they stamped on the bottom, and they have a nice fusiform fuselage as it's kind of attached in there, and you can see it's nicely done. The rear tip video will kind of go to the back end and see how the rear tips kind of attach on here. If you look at the max thickness of the back of this, right at the back of the thinnest portion, you know, just looking from the rear tip out, we're looking at 17.6 on the back end. That's this right here. That's if you deflated the implant, right, all the way, and you're trying to insert it as a surgeon, which one is the least width, right, on the back end of the implant. I'm just measuring from here to here, right? That end, I'm getting, hold on, $17.6. If I'm doing it on the back of the AMS product, I'm getting that. Let me make sure I measure it twice. Measure twice, cut once, 17.6, same. So I'm measuring the same, but it's more of the angle. This is a little harder. Does that make any sense? Like the thickness here from the nose is better. This has less of a shoulder, but they're both 17.6, which is good. So pros and cons for both. Definitely a patient with Peyronie's disease, I'd be thinking more about a CX or a Coloplast. I think these are better implants. Somebody needing multiple revision surgeries, I would think about a Coloplast implant because you don't want to risk that Dacron. And truth be told, I've left pieces of old AMS implants, or I just can't seem to get all of this stuff out of the guy, because your body starts to grow into this sleeve, you know. But then again, if the guy's like, hey, I don't want dog ears or corners on my penis, this is a better device. Otherwise, you know, I think that's an unbiased, fair review of both the implants. And we did not talk about Rigicon. We will probably have another video and we'll add them in when they're approved here in the US. I know they're on their way to getting that done. Again, Dr. Hakky, and we'll send another video to you guys about rear tip extenders.